Okay, there's my patient. Okay, desk. All right, make sure we can see everything. Okay, so I'm going to start my head-to-toe assessment. As I walk in the room, I'm going to make sure there are no posted precautions, contact droplet, and make sure I'm following them. I'll perform my hand hygiene before I walk in the room, and as I'm coming in, I'm going to assess the floors to make sure there is nothing that is a fall risk for my patient. Also, just to make sure the side rails are up, but that the patient is not restrained by them. And hi, I'm going to introduce myself.
Hi.
My name is Tatum. I'm going to be your nurse today. Can I take a look at your wristband?
Yes.
Do you mind telling me your name,
Caroline Cunningham,
date of birth?
9/28/96.
Perfect. And I'll make sure her EMR number matches the one that I have in the computer. Can you tell me what year it is?
2020.
Do you know where you are?
I'm in the hospital.
Do you know who the president is?
Trump.
Perfect. So I see that she's alert and oriented to person, place, and time. Also that her speech is normal and she's not combative at all. Her behavior is normal. So what I'm going to be doing today is just a head-to-toe assessment, kind of checking all of you system by system, just to make sure that everything's in line, if that's okay with you.
Uh-huh.
Perfect. So now my patient is informed. I'm going to start with the neurological system. So first I'm going to check her level of consciousness, and obviously she is alert and oriented, and also her Glasgow Coma Scale, checking her eye movement as well as her responses, would be a 15, a full 15. So starting with that, I'm going to go ahead and have you follow these cat whiskers, just to check the cranial nerves 3, 4, and 6. Perfect. Alright, perfect. And then if you follow in, that's for accommodation. And then if you'll just look straight at me, I'm going to check for perla. So the pupils are equal and reactive and round. To light and accommodation, do you mind squeezing my hands really quick? Perfect. They're equal bilaterally. Can you move your arms for me? What about your neck? Do you have any motion in your neck?
Yes.
Good. It's really supple. What about your legs? Awesome. So you get up and walk around easily?
Mm-hmm. Yes.
Perfect. Just make sure there's no walker. If there's stand-up assist, that everything is going well there. Also, she is sitting up. She is properly positioned in bed, so I do not have to worry about moving her back up. So next I'm going to move on to her cardiovascular system. So just to kind of begin, I want to ask, do you take any medications for your heart?
No.
Heart history? Perfect. Are
No.
you allergic to any medications?
No.
Awesome. So I'm going to listen to all 5 points on the heart. And they sound good. Just make sure that there's no S3, S4 or any murmurs. Starting from there, I'm going to check your cat refill. So I'm going to check on your fingernails. Perfect. And then checking both peripheral pulses here and then feet. They're equal bilaterally. And also pedal. Do you mind if I take this mic off? Perfect. And check pedal pulses. Perfect. She doesn't seem to have any swelling, and also she is warm and dry, which is great. Do you feel okay with everything? Yeah, she drinks enough fluids. She's been doing well. I'm also going to take this time. Do you mind looking up for me? I'm going to feel right in your neck area just to check for your thyroid gland, and also to make sure that your trachea is midline, not deviated. I don't see any jugular venous distension, which is great. Also, just feel around on your lymph nodes. Make sure there's no soreness. Is there any soreness or pain? Nope. Awesome. Now, since I've done all that, I'm going to listen one more time to her respiratory system. Do you mind sitting up for me just one more time? Perfect. So I'm going to listen to all 14 spots down the back. And this is a good time to ask, have you had a cough recently?
No.
Good. And if they have an incentive spirometer at the bedside, I'm going to teach them how to use it. And the importance of it, especially after surgeries. So you sit back for me, and then I'm going to listen to the front, especially in the bases is where we find crackles. So all spots on the front. Perfect. This is also a good time to assess, is my patient on oxygen, and check your O2 sat, probes on the finger, moving the probe off the finger if you need to change the site so it doesn't wear away. But she sounded clear bilaterally, so I'm going to go ahead and move on to her GI system, which I'm going to listen one more time. Listen to all 4 quadrants. This is also a good time. When was your last bowel movement?
Yesterday.
Do you have any trouble going to the bathroom?
Nope.
Nope. Perfect. No pain?
Nope.
Awesome. So I listen to all 4 quadrants to make sure they're present, and they are. They're moving just fine, and checking to make sure that it's shaped correctly, no distension. And then I'm going to percuss all 4 quadrants and palpate, just to make sure that I don't feel any masses. This is also a great time to check for bladder distension. Have you had any trouble peeing?
No.
Does it hurt when you go to the bathroom at all? Is your urine normal colored, yellow straw? Perfect. So, have you had any vomiting recently?
No.
No? Perfect. So, just checking to make sure they're not in any pain there. Are you in any pain?
Nope.
When I touch anywhere? No?
Mm-mm.
Alright, so on a scale of 0 to 10, what'd your pain be?
0.
0. Perfect. So we don't need to do any pain control, which is important. Also, while I'm here, this is a good time just to check the integrity of her skin. Does she have any wounds in the area? If she does, how is the wound closed? What's the drainage like? Is there any odor? And also just to check that she's not getting any pressure ulcers while she's sitting there, and check her skin turgor. So I'm going to go ahead and tick on each side, which is good. Her skin is dry. She's moisturized and well hydrated. And she's also appropriate color-wise for her race and ethnicity. So that's great. Do you mind pressing down on your feet for me?
Mm-hmm.
Perfect. Just checking the gas pedals are going well. I've already taught you about your incentive spirometer, and since I've done a whole scan of her body to see wounds, I can also see if she has any IV sites. And if she does, how does the site look? When was the dressing last changed? Good to go well. So right before I walk out of the room, I've checked your O2 sat, but now I'm going to check your other vitals. So I'll take your heart rate if you're on that device, the O2 sat monitor. Typically that will tell me, but I like to listen. Take your blood pressure. I've checked your pain. Take your temperature. Typically orally is the best way to do it. And document all of these before I leave the room. So do you have any questions for me?
No.
Do you have any specific complaints?
No.
Perfect. Well, I'll be back to check on you later.
Thank you.
Of course.